Okey, Assalamualaikum warahmatullahi wabarakatuh kepada kelas 5E. Okey, 5E untuk kod PAD350. So hari ni kita akan menghabiskan presentation and then orang kata kita akan tengoklah presentation ni. Okey, madam menunggu tapi ramai lagi tak masuk ni. So tak apalah, kita proceed dulu. Sekejap.
And that's why the World Health Organization works to make sure that everyone, wherever they live, has access to medicines and essential health services when they need them. Based on research, WHO sets standards and makes recommendations that protect people as they grow, live, work, and age.
Assalamualaikum, my name is Muhammad Abdul Fahmin bin Muhammad Amin. I am from class AM 1105E. The introduction of SDG is SDG are the group of 70 global goals set by the United Nations. The goals of SDG are very broad and interrelated, although each has its own targets to achieve. The target number is 169. SDG also covered a wide range of social media and economic development issues. Issues are related to SDG, poverty, healthy, education, and climate change. SDG are also known as Transforming Our World, the 2013 Agenda for Sustainable Development. Its main target is to eradicate poverty. As we know, the development progress of a country is measured by the poverty rate. The selected goal our group has chosen is good health and well-being. This goal aims to ensure healthy life and promote well-being for all. This goal addresses all major health priorities such as reproductive, maternal, newborn, and communicable disease. Besides that, this goal also aims to achieve universal health coverage. This includes access to essential medicine and vaccines. I think that's all from me. Thank you.
Hi, Assalamualaikum. My name is Nurul Syafiqah binti Abdul Aziz. Today I will proceed about the description. The World Health Organization is a specialized agency of the United Nations who are responsible for international public health. The WHO Constitution states an objective which is the attainment of by people who are higher possible level of health. The WHO mandate and seek and including working worldwide to promote health, so that the WHO at Western Pacific make a division of program to control disease. Under this division, we focus on three key areas. Firstly, the TB and leprosy elimination. Through this, the WHO make a activity which is to enhancing prevention of TB and care service. In 2020, the WHO at Western Pacific region was responsible for 1.8 million of the 9.9 million incident about the tuberculosis worldwide. TB remains a serious public health in this region. Slow progress prevention may be attributed to the stigma associated with the disease. Fear of transmission of sick individual may be source of the stigma. One way they accomplish is by promoting TB clubs, where persons who have been implicated can discuss their stories and offer support or by monitoring. At the same time, there are several examples how they use the initiative to improve TB treatment coverage. For example, they include enlisting to help of private sector. The second activities under this program, which is mental health and substance use. Mental health and substance use disorders, suicide and neurological disorders such as dementia afflict nearly 200 million people in the Western Pacific region. People with mental illness still stigmatized, making them vulnerable to abuse and preventing them from receiving much needed help and service. Strengthening government on mental health, such as promoting mental health to prevent this from spreading, is one of the activities. This helps to improve the delivery organization, accessibility and quality, as well as increase engagement with stakeholders, which is such as people with life experience and general public. In addition, the World Health Organization collects the information on mental health through the Mental Health Atlas and collaborative with our partners and networks to build leadership and strengthen governance. Last but not least, in the Western Pacific region, non-communicable disease, primarily cardiovascular disease, cancer, diabetes and chronic, primarily a causes of mortality and disability. If immediate action is not done, NCD related to mortality and disability will continue to rise. The WHO Western Pacific Region Promotion Program assists member states in implementing global and regional action plans to prevent and control NCD disease, increasing the priority given non-communicable disease through international collaboration and lobbying, strengthening national capacity to speed up the country response, reducing modifiable risk factor through the establishment of health promotion settings. Next, the goal about this program, which is to terminate the epidemic of TB by 2035 and consider to reduce of leprosy burden in Western Pacific region. The session helped to countries design, execute and monitor national strategy by providing a leadership, advice and technical assistance, as well as bringing a partners for a coordinated approach and articulating evidence based on policy solutions.
Hi, Assalamualaikum. My name is Namra Ahmad bin Zulkifli. Okay, I want to talk about the benefit of the programs. The first benefit is celebrate World Health Day to raise awareness of the global community. World Health Day discuss the establishment of the World Health Organization as a goals. The Constitution came into force on 7 April 1948, at which time 16 countries signed an agreement for the establishment of non-governmental organizations. It was one of the first official WHO events. The program was first held on 22 July 1949, but the date was later changed to 7 April to encourage the participation of the students in the events. World Health Day provide an opportunity for the globals to focus on important public health issues as well as influence the international community. In celebration of World Health Day, wildlife promotion programs has been launched continuously for an extended period throughout the years, starting on 7 April. The importance of World Health Day is that World Health Day has been launched on a global scale. This event is one of 8 official WHO global health campaigns. The celebration emphasizes health awareness activities around the world. It also important to raise awareness of the importance of taking care of our health. Through campaign and health information channels, it can help reduce disease that relate stigma, and more people will seek medical treatments and support. To live a healthy life, it is very important to be aware of and follow the trend and campaign of World Health Days. By celebrating World Health Day like this, it can raise awareness of the global community. The second benefit is the needs for strong WHO involvement in governance. As we know, every party involved and needs to take a leading role in improved health and has a valuable resource to encourage the community to take the positive steps toward their own health. One of the areas of future global governance for WHO is focus on efforts on major trade issues that concern medicines. Among the example of the effort is the Kyoto-style medical treaty. It encouraged countries who sign on to invest a percentage of their gross domestic product in medical innovations. It also enabled countries to trade credit with other countries for investment in a manner similar to that designed in the Kyoto Protocols to control environmental emissions. WHO is to play a critical role in agenda settings, treaty contents, consensus building, and ultimately member state ratifications and implementation relates to this treaty. No other international organization has the normative or technical capacity to address distinct global health issues such as finding treatment for neglect disease or open drugs in developed countries, while at the same time it also addresses concern over intellectual property protection as a means to incentive innovation, research and development. In conclusion, the effectiveness of global health community depends on the needs for strong WHO investment in governance.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sadatul Amira binti Saibin. Next, let's move on to the suggestion of improvement for the program. The first suggestion that I will give here is campaign on the disease control. The worldwide organization WHO should launch this kind of campaign. Why? As we know, the public people are more aware when the seriousness of the disease is spreading, especially on the worldwide campaign. So mostly people are asking why campaign. It is because campaign can be motivating people of all ages, especially the young generation or the children, to receive immunization and can include additional information for them about the dangers of any disease such as TB, mental health, and also non-communicable disease such as cancer. I would say here is this kind of campaign is an easy approach for the WHO to make sure that the public are aware about their health and surrounding. This is also to fulfill the 12 Sustainable Development SDG, which is the good health and well-being. The suggestion is medical checkup, monthly medical checkup. For monthly medical checkup, I would say it is also a good approach to prevent the public from any serious disease. Why? For me, when public always concerned about their health condition and always do the checkup, it would be easier for the doctor to detect any serious disease that would occur. The example that I will give here is the COVID-19 virus. At the first place, people are not interested to take care of their health, but when this new virus occur, they will automatically do a checkup when they detect an early symptom. The last word from me is the quick action that we take, the more life that we can save in future. Let's move on to the next presenter. Thank you.
In a conclusion, World Health Organization (WHO) has launched a disease control program for the elimination of tuberculosis and leprosy by holding activities to improve TB prevention and care services. This is because tuberculosis is the second largest health disease in the world after HIV. To those who have been infected with TB can follow the TB Club to facilitate discussion about the disease they are experiencing. Not only that, mental health management activities and non-communicable diseases such as cancer are also part of the program.
This is to provide awareness of the importance of healthcare not only mentally but also physically to live a good life in the future. However, WHO not only focuses on people who have not been affected by the disease, but they are also ready to provide services and counseling to people who are already infected so that they always have the spirit to fight the disease. That's all from us. Thank you for your attention.
Okay, thank you kepada grup yang terakhir ni. Okay, kamu buat pasal WHO, World Health Organization. Lepas tu dengan Madam ni ingat, betul ke ni Coffin Squid Game? Lepas tu tengok-tengok, betul ada kokoma semua. Minat betul kamu dengan Squid Game eh? Okay, but then a very good presentation. Maknanya orang kata, of course lah, World Health Organization memang antara satu pertubuhan yang sangat-sangat besar lah. And then bila kamu cakap pasal tu, kita lebih memahami apa itu World Health Organization. Okay, so Madam akan start memberi markah. World Health. Okay. Presentation skill. I must say that okay lah, dalam 5 lah Madam boleh beri ya. Boleh improve lagi tapi boleh lah. Okay. And then the content is good. Personal appearance, of course. Teamwork. Okay, kalau tak jadi kot. Squid Game tu. And then creativity. Okay lah, Madam bagi 5 lah. Okay, so total dapat 28 lah kot. 28 per 30. So Madam sebenarnya bagi markah tinggi-tinggi ni untuk menghargai lah effort semua yang susah-susah payah buat presentation ni. Alright. Berapa bulan ni hari ni? Masih lagi. Alright. Okay, so Madam nak tanya macam mana dengan test hari tu? Okay ke? Okay. Alright, suka ke dengan markah ni? Okay. Okay, hari tu test hari tu okay ke?
Okay, Madam. Okay.
Okay, Madam.
Kebanyakannya buat soalan nombor berapa?
4.
Nombor 4. Kenapa? Oh, lagi? 4 memang ramai orang menjawab lah. Lagi? Mana lagi?
2.
Okay, so nanti Madam akan marking dan Madam akan letak dalam ni So kamu jangan risaulah carry mark apa semua Madam akan letak dalam ni. So Madam akan tengok juga masa nak buat carry mark tu Madam akan tengok juga kamu punya quiz. Bukan quiz. Tengok jugalah yang latihan-latihan yang kita dah bincang, kamu buat ke tak buat ke. Okay, so ada yang jawab soalan nombor 1 tak? Adakah yang jawab soalan nombor 1? Define community development and then 5 stages of community development by Bone 1998. Soalan ni terpecah kepada 2 iaitu A dan B. Okay, so ada jawab soalan nombor 1 tak? Ada yang jawab soalan nombor 1 ke? Ada? Ke tak ada?
Tak ada.
Tak ada. Okay, so this is the jawapannya. Yang paling penting sekali adalah the elaboration, the examples. Okay. Okay, ini cara pengiraan markah dibuat. And then Okay, soalan yang kedua. 4 category of town in life cycle suggested by Bone. Nah, semua ni dah ada dalam slide, dah ada dalam modul Cuma tinggal kamu nak olah je, nak bagi satu perenggan tu macam mana. So kita ada sini 4 categories of town adalah boom bust town, towns of uncertainty, diversified towns and then sustainable towns. Okay, sometimes bila kita kata kena ada introduction 3 marks, student take for granted apabila macam letak je apa-apa. So suggestion madam kat sini, make sure the introduction tu relevant dengan answer ataupun the question. Kalau dia tanya categories of town in life cycle, so kat sini kamu boleh letak apakah atau kamu define ataupun kamu explain konsep ataupun pasal sedikit sebanyak perihal life cycle model tu. Alright, so dan kita ada 4 tahun ni. And then tutup dengan conclusion. Ini kalau markah penuh 25 marks. Alright. Okay, untuk yang soalan ketiga, ada yang buat soalan nombor 3 ke? Ada ke yang buat soalan nombor 3? Ada ke? Soalan nombor 3 ada yang buat ke? Tak ada. Ha?
Tak ada ke madam?
Tak ada? Okay, so 3 types of popular settlement elastic. Ni macam boleh buat banyak sebab kita memang kupas banyak. Pasal sustainability model, pasal ni, okay, senang. But in this type of question, you don't have to do introduction and then conclusion, alright? And then, so bila tanya pasal tu karakteristik of ideal scientific model, dia minta tu. Memang dalam buku jawapan dia ada 5, 6, 7, 8. Just ambil 2 saja. Sometimes student ni dia tak tahu nak elaborate, dia bagi banyak-banyak. Tak dapat juga markah tu sebab kita nak 2 point dengan elaboration dengan example. The most important thing is you write down the elaboration so that kamu faham. Okay, so dalam yang ni soalan banyak, pilih satu saja. Okay, so kamu taklah risau sangat kan. Okay, 4 actors that should involve in pursuing. Okay, yang should be involved in pursuing lah. Okay, sama lah. So kat sini, yang ni lah soalan paling banyak kamu buat ben senang kan. So pilih yang mana kebanyakannya. Walaupun ada 6, pilih 4 saja. 4 yang paling kamu familiar dan yang paling kamu orang kata boleh nak elaborate. Okay, supaya boleh sikit markah. And then soalan yang kelima pasal NGO. Yang ni madam saja buat. Okay, nak relatekan dengan assignment, okay, yang kamu dah buat ni. So berilah 4 NGO daripada assignment kamu ke, kawan-kawan ke. Nak kelempang ke? Okay, so ada ke yang buat soalan nombor 5 ni? Ini pun soalan yang macam agak bonus jugalah. Bercari mana-mana NGO yang membuat sustainable, yang ni lah yang ada SDG, yang pursuing sustainable development. Ada ke yang buat soalan ni? Ada ke? Ada tak? Tak ada.
Ada rasanya madam.
Takkan semua orang buat soalan nombor 4, soalan 4? And then soalan nombor 6 ada ke buat? Tak ada juga. Akbar. Okay, so dalam final exam nanti, final test lah maknanya. Okay, so make sure yang kamu dah tahu dah, maknanya orang kata dah well versed dengan soalan-soalan yang okay. So ini adalah soalan-soalan SEM lepas. Okay, tu political obstacles. So sebenarnya SEM kamu ini baru 2 SEM di mana PAD350 essay. Kalau tak sebelum-sebelum ni adalah menggunakan semuanya true and false and ni lah multiple choice question. So okay, dalam ni nampak ni. So madam tak nak lah masa kamu final test nanti baru terkial-kial nak cari chapter mana. Ni chapter berapa ya, sebab it will take time. Sepatutnya masa yang kamu ada tu, okay, sekarang ni kamu kena ambil macam ni orang kata peluang kamu untuk tak payah dah macam dia buat exam kena hafal kena apa, just faham. And then kalau tak faham tu tengok saja, elakkanlah terlampau copy paste sangat dalam modul. Madam kalau copy paste sangat dalam modul, sorry madam memang bagi markah sikit je. Sebab bagi madam bagi tepung, buatlah kuih ke kodok ke apa. Ini kamu semua malah duk buat juga orang kata benda yang apa yang madam tulis dalam modul. So tak guna juga apa yang kita cari di internet. Janganlah terlampau copy paste. Gunalah ayat sendiri. Okay, berdirilah atas kaki sendiri. So ini adalah antara soalan-soalan lah kalau kita tengok yang ni. tu political obstacle. Ni tak silap Madam chapter 5 dengan chapter 6. Okay, so untuk question 1, untuk B, chapter 1, define sustainable development, and then 4 importance of sustainable development. Yes, ni chapter 1. Okay, yang question kedua, 4 characteristic of boom bust town. Ada model-model ni, ada tertentu chapter 3. Tak silap Madam chapter 2 memang tak masuk dalam final. Okay, 4 roles of United Nations. Yang ni chapter 4, wajib baca. Dia akan tanya. Okay, so this is the answer. And then chapter yang keempat adalah, soalan yang keempat datangnya daripada suggest for environmental protection in sustainable development. So this is, okay, kalau lebih baiklah kalau kamu dapat ada orang kata, yalah kalau betul-betul nak belajar kan. Ini modul Madam. So kalau kamu boleh print, tapi yalah dah terlambat nak print. Ada ke yang print nota ni Madam nak tanya? Supaya boleh study secara lebih ni. Ke tak ada yang print? Ada ke yang print? Tak ada dulu Madam wajibkan print sebab Madam takut korang tak faham ke apa. Madam bagi, tapi Madam dah bagikan soft copy, betul tak?
Betul, Madam.
So soalan nombor 4 lah, environmental protection is sustainable development. Okay, ni chapter berapa ni kelas? Environmental protection in sustainable development. Siapa tahu ni chapter berapa? Obstacle dah ada dalam chapter 6. Ini mungkinlah chapter 5. Chapter berapa ni gerak? Environmental protection in sustainable development. Chapter berapa ni? Chapter berapa kelas? Okay, but this is the, inilah soalannya. So Madam harap kamu semua dapat ni lah, jawab elok-elok final test. Bila kita final test kelas? Jot down the tarikh. Bila kita final test? Bila kita final test? Tak tahu lagi ke?
9 bulan 2 ke Madam?
9 hari bulan 2 okay, so ada masa lagi lah untuk study. Madam harap PAD350 menjadi antara paper yang A lah, boleh tak agak-agak?
InsyaAllah boleh.
Okay lah Okay semua, sampai berjumpa lagi pada minggu hadapan. Kita akan bincang, kita akan wrap kan. Dan sedikit sebanyak kita akan sakit hati ni anak Madam. Okay semua. Okay semua, Assalamualaikum.
Salam Madam, terima kasih Madam.
Thank you. Terima kasih, Madam.
Thank you, Madam.
Safia semua. Okay, bye. Assalamualaikum.
Waalaikumsalam. Thank you, Madam.
Bising.